They are here to help, and they're doing just that at the largest hospital in the area. A look at what the military is doing to help healthcare professionals treat patients during the worst surge of the pandemic. Curtis Flowers is going back to court, but this time he's on the side of the prosecution and suing the man who tried him 6 times for murder. And are you ready? High school football week 2. It's Friday night. And we'll look at some of tonight's action. WTVA 9 News on WLOV starts right now.
Live, local, late breaking. This is WTVA 9 News.
Thank you so much for making us a part of your Friday night. I'm Emily Leonard in for Alyssa Martin. Military medical personnel are lending a helping hand to local healthcare workers in response to the rising number of COVID cases. 20 new workers with the Department of Defense's COVID-19 response operation are doing their part to help this wave of COVID cases. The new team consists of physicians, nurses, and respiratory therapists. Leaders of the response team, Stephen Duria, said that with healthcare workers leaving, they are ready to help the hospital with the extra workload.
It's busy, but that's why we're here, is to offload and to assist their team by the assistance of our team. But again, it's our teamwork together that's making the mission successful.
This is the first deployment by the Department of Defense medical assets to support Mississippi during this pandemic. Duria said that they will remain at the hospital as long as they're needed. Today, the Mississippi Department of Health confirmed more than 3,300 new cases in the state and 33 additional deaths. And looking at this chart, you can see that 99% of the new cases are involved with the unvaccinated, as are 87% of hospitalizations and deaths. This is why the state health officer, Dr. Thomas Dobbs, continues to ask everyone to get the vaccine. And if you do test positive, ask about the monoclonal antibody treatment. Meantime, the Alabama Hospital Association is calling for help. As of right now, doctors say the state has more COVID patients than they have ICU beds available. The state reports having just over 1,500 staffed ICU beds and nearly 1,700 ICU patients. Among the adult patients, more than 80% were never vaccinated. And Tennessee now tops all of the states with the number of new coronavirus cases. That's according to today's report from the CDC. The state with the next highest rate, South Carolina, followed by Mississippi, Florida, and Georgia. That was rounded out the top 5. Still, Tennessee Governor Bill Lee says he does not plan any changes to current COVID policies. Tennessee educators report 19 school districts have closed since early August due to COVID outbreaks. Federal health officials are closely monitoring a new COVID variant that has been named Mu by the World Health Organization. In keeping with the WHO's custom of naming the most important COVID variants, Mu is the 12th letter of the Greek alphabet. When asked about this new variant, Dr. Anthony Fauci said he doesn't want to downplay the risk, but he doesn't think it's an immediate threat.
We certainly are aware of the Mu variant. We're keeping a very close eye on it. It is really seen here, but it is not at all even close to being dominant.
The CDC reports the Delta variant now accounts for 99% of the COVID cases diagnosed in the U.S.